organ harvesting can be for, number one, organ transplant, or it can be used for research. Okay, so for organ transplant, minimum send you out an organ from one person, and you put them on another person. So there has to be a donor, and there has to be a recipient. For organ transplants, it has to happen in a hospital. Minimum send that person must die in a hospital, inside the facility where he got an intensive care unit, and he must also be on a ventilator. Now that is the official organ transplantation himself happened. Now, before the organ transplant, there has to be some information, some consent given for organ and have to be transplanted or donated to someone during the transplant and after the transplant, because there has to be a process where you match him donor with him recipient, so that after the transplant, he must not get any reaction. Now, for a transplant, it's very expensive. It can be cheaper in some places like India, but it ranges around 250,000 to 400,000 USD for transplant to happen. For level playing of Solomon Islands, the Ministry of Health and Medical Services, we don't have an intensive care unit. We only have a high dependency unit where Mifalas are keeping very sick ones, but immunobaram capacity for maintaining people on ventilator. We don't have the professionals for doing that pre-information during and post. So low level blaming of Solomon Islands, National Referral Hospital have no guarantee capacity for doing that organ transplant. Even for Mifala sponsoring someone for overseas for doing transplant, we don't have the money to send someone to do that. Yeah, so this one here for Thailand, a lot public, whether you are in Honiara or out there in the provinces, that none of our doctors in country or the nurses are capable of performing donor transplant or harvesting. It will then have to be done in a proper, well equipped facility. Yeah? So you may not guarantee that for a facility of Solomon Islands we are capable of harvesting any organ, even for you doing in the local or anywhere like province or any private clinics, have not possible for you to do. So be rest assured that none of the health professionals, this is including nurses, doctors, even consultants, but are able for doing this organ harvesting or organ transplant. Now the other field of it is to do research. If a company wants to do research, say for example, like growing anything, any organ, the only organ where hens have a shed every 4 weeks is the skin. And there are some labs where it's successful or hen. But for you growing brain, heart, kidney and lung is beyond the human technology. Only God must have doing that. One for growing, not in for doing that. In order for take them away of the organs out of the country, there has to be process too, yeah. And I'm sure that this afternoon by Falaherem, and be assured that all checkpoints behind check like how now things are transported out, because there has to be some preservation for these organs transported out or out of the country for research purposes. Yeah? So we have a regulated body where if any doctor or any nurse, they are guided by these bodies where if for practice beyond their capacity, they will be disciplined for it. Yeah? So we have the Nursing Council and the Solomon Island Medical Dental Board, where started guiding that practice within the country. To do with research, anything to do with research, it has to go through immigrations and other points of contacts, checkpoints, yeah, for go out of the country. And I would like to reassure you all that no two things say any nurse or any doctor have involved na lo this fala removal of the organ with the instruments with them. These instruments has to be, it's a subspecialist area, yeah? Where Solomon Island simino garem any subspecialist doctor yet. Imi garem normal specialist doctor. Yeah, so I think if you have any other questions in related to anything where you worry about, you know, the organ harvest and trafficking, you can ask questions coming forward. Yeah. Thank you. I think I'm normally got it for you.
Thank you.
So, yeah.